Definition of stroke, Part 2. The patient is oriented frequently and reassured with verbal and tactile contacts. The ability to speak is assessed and aphasia is present of consultation by speech therapist is obtained. Bladder function is assessed. Non-invasive measures are used to encourage voiding of the presence of urinary retention. Voiding pattern is determined and the incontinent patient is kept clean and dry. Use of dwelling catheters is limited because these promote urinary tract infection. Bowel function is assessed and dietary intervention and stool softeners or laxatives as necessary are used to prevent constipation. Straining at stool or use of enemas is avoided. Fluid and electrolyte balance, intake, output, daily weight, laboratory values is monitored and maintained. Adequate internal or parenteral nutrition is provided as appropriate. Nursing measures are instituted to prevent complications of immobility. In consultation with occupational therapists and physical therapists, a program of positioning and mobility should be initiated as appropriate. Example of activities include repositioning at least every 2 hours, maintain correct body alignment, supporting joints to prevent flexion and rotation, contractures, and providing range of motion exercises. Passive to involve joints, active, assisted, or active to uninvolved joints. Irritations and lubrication prevent oral mucous membranes and eyes cornea from drying. Prescribed medical therapy is administered to decrease cerebral edema, and antihypertensives or anticoagulants are given as appropriate for etiology. The patient is observed by seizure activity, and drug therapy and safety precautions are initiated. Rehabilitative phase. After the acute phase has subsided, the focus shifts from obtaining baseline measurement and providing necessary life support to promote more comprehensive rehabilitation efforts. Long-term rehabilitation goals depend on the severity of the initial stroke, the age of the patient, the presence of comorbidities and other chronic conditions, prior functional status, and ability to perform activities of daily living independently, and the family and social support. System available to the patient. When the patient is medically stable, he or she may be transferred from an acute neurological hospital unit to a rehabilitation setting or a subacute setting. Here, the rehabilitation team collaborates with the patient and family to develop a comprehensive care plan based on realistic goals. The rehabilitation program will consist of various types of exercises, including neuromuscular retraining, motor learning, and motor control, and functional activities that emphasize learning or retraining in basic skills required for self-care. This may include instruction in the use of adaptive and supportive devices to facilitate independence in daily tasks. The goal of rehabilitation is to achieve an optimal function outcome that will allow the patient to be discharged to the least restrictive environment. Ideally, the patient will achieve sufficient independence to return to community living